The particle size of the API has a impact onto the drug product CQS. Drug substance particle size or API particle size is a critical material attribute of the API, and it affects the critical quality attributes of the drug product. The drug product may be the formulation like tablet, capsule, or oral suspension, or other formulation. In all the types of formulation, drug substance particle size affects the drug product CQS. In this video, we are going to learn regarding the API PSD impact and its risk assessment, mainly for the oral formulations. I welcome all the viewers to this video, and after watching this video, you will be able to understand how the risk assessment is to be done for the impact of API PSD. The particle size distribution of not only the API but also the excipients impact the drug product CQS. The risk assessment of the excipient PSD is also required to be done, and it is required to be controlled. So drug substance particle size will be controlled through the functionality characteristics or control strategy for the uniformity of the drug excipients CMS. Once again, we will start with the introduction for the formulation development with a risk assessment of the API PSD. If you are working onto the generic formulation, then the API PSD will has a great impact on bioequivalence. If you are working onto the novel formulation, then the API PSD will have impact onto the bioavailability. So in short, the API PSD impacts not only the physical characteristics but also it impacts the other formulation quality attributes. Particle size distribution directly impacts the performance of the formulation and also the manufacturability of the product. PSD has impact onto the flow properties, then content uniformity will be affected, compressibility will be affected, solubility will be affected, dissolution rate and bioavailability. In short, the PSD has impact onto the safety and efficacy. PSD also affects the stability of the formulation. Now, whenever you are going to do the risk assessment, you should understand what are the three levels of risk assessment to understand the risk level and the severity of the impact. So there are three levels: high level, medium level and low level. Now take the API PSD as a variable and risk to be considered for the dissolution and bioavailability, as the smaller particles will dissolve faster and coarser particles may lead to delay in the drug dissolution and drug release. So the impact will be high onto the dissolution and bioavailability. But if the API belongs to the class 2 and 4, then it will have high impact. Severity is high, impact or risk level will be high for the BCS class 2 and 4 drugs because these are low soluble drugs. But we should consider the risk for the BCS class 1 and 3 drug substances also. Many of the times the solubility is high for the API, but dissolution get impacted by the PSD. Then content uniformity. So it is medium to high considering or depending on to the formulation. Fine or irregular PSD can cause segregation during blending, during compression or capsule filling. and in the suspension formulation also. So as per the formulation, API load in the formulation or percent API, you can make it like medium to high. Flow properties, fine particles may cause flow problem affecting the capsule filling and dye filling in tablet. Also, it can affect the sachet fillings. So it is considered as medium, and it is required to be controlled through the formulation development and process development. Compressibility, tablet hardness, it is the in process or finished product testing. Large particle may reduce the compressibility and fine may cause capping or lamination. So anything can happen because of the API property and API load in the formulation. So risk level is medium and its impact will be medium. Sometimes for some of the formulations you can consider as high severity also. Stability. So smaller PSD may accelerate degradation due to increase in the surface area or specific surface area. So considering the formulation, you can make it either low or medium. Filtration, granulation and some other risk areas may be there depending on to the product and process. In wet granulation, PSD can influence binding, granule formation, so medium risk can be assigned. Depending on to your product, you can consider the risk. Just think that you need to justify that risk and study the risk to eliminate or to the get it to the lower level. Different tools can be used for the risk assessment. QBD approach can be used. Use the Ishikawa diagram to identify root causes of variability. Conduct FMEA on the PSD parameters. Critical assessment. So identify if the PSD is critical material attribute influencing the critical quality attributes of the drug product. Also link BCS classification to the PSD. If drug substance belong to BCS class 1 and API load in the formulation is low, then the dissolution may not be affected by the PSD, but the content uniformity can get affected. So you need to have the understanding about these parameters. DOE can be applied to study the effect of PSD on different drug product CQAs. Control strategies for the PSD. We need to have the vendor qualification with PSD specs in place. We need to have data from number of batches for the PSD. We need to have in-process controls for the PSD. Setting the PSD specification, 3-tier PSD specification to be set for D10, D50, D90 and link the PSD impact to the biopharm or biopharmaceutics. Especially consider PSD as high impact for the BCS class 2 and 4 drugs where the dissolution is rate limiting. Then regulatory expectations to be considered for impact of the PSD as per ICH Q8 and Q11. PSD should be justified as it is linked to the CQS. It should not be like that you are considering the PSD of the API as a critical parameter for the impact on drug product CQS, but you are not going to have a control strategy for that. So it should not happen. For biowaiver applications, PSD must be comparable to the RLD if it is impacting the dissolution. For ANDA submissions and for other generic applications, need to include justification for control strategy for the PSD. So this is the information regarding impact of PSD. PSD has impact onto the solubility, dissolution. So it will have impact onto the bioavailability and the bioequivalence. Also, it has impact onto the content uniformity, uniformity of dosage units, flow, compressibility, tablet hardness, stability, and also it will have impact onto the safety and efficacy of the product. So PSD specifications are to be set. I have made some videos on API PSD. So I suggest you to go through those videos so that you will have the better clarity about the topic. Thank you for watching the video.